And our question of the week, and one that a lot of people have been asking me, is Medicare Advantage really free? And yes, there really are Medicare Advantage plans with $0 monthly premiums. But zero premium does not mean free, and it definitely doesn't mean no cost. First, you're still going to pay your Part B premium, and then you'll be paying as you go with copays, coinsurance, prescription costs, and other out of pocket expenses throughout the year. Medicare Advantage plans also have an annual maximum out of pocket limit for medical expenses, usually several $1,000s, and you have to reach that maximum before you're ever covered in full. Hey everyone, welcome back to Coffee with Casey, the weekly conversation that helps you navigate Medicare with confidence. I'm Casey Albom. I'm the Senior Medicare Advisor here at the Albom Insurance Group in Margate, Florida. We're a family-owned agency that's been helping people navigate Medicare for more than 30 years. And over that time, we've had the privilege of helping thousands of families right here in Florida and all throughout the country. Many of my clients refer to me as their Medicare co-pilot. And as many of you know, I'm also a private pilot. And one thing that flying has taught me is that there are usually several different ways to get somewhere. The important question isn't simply which airplane's better, it's what's your mission? Where are you going? Who's going with you? What's important to you along the way? And Medicare really isn't that different, because one of the questions people ask me all the time is, Casey, which is better, Medicare Advantage or a Medicare Supplement? Well, that's actually not the question that I want you asking. Today, I want to give you a better one. Which approach really gives you the kind of freedom that you want during retirement? Because there are two very different ways of receiving your Medicare benefits. And understanding that difference is at the heart of what I call the Freedom First framework. So grab your coffee and let's get into it. I always like to start with our Medicare myth of the week. And this week's myth is, if I choose the wrong Medicare option, I can always change later on. This may be one of the most important Medicare myths we've covered, because this one trips people up. Because technically, yes, there are opportunities to change your Medicare coverage, but that doesn't mean every option will necessarily be available to you later. And this is especially important when we're talking about Medigap or Medicare supplements. When you first become eligible for Medicare Part B, you generally have an opportunity to purchase any Medicare supplement plan from any company that offers it without medical underwriting. But later on, once your Medicare Part B has been active for 6 months or more, you'll have to answer health questions in most states to be able to qualify for a Medicare supplement plan. And if you didn't sign up, or if you chose an Advantage plan, you may not be able to switch until the next enrollment period. So when someone tells me, I'll just choose this now and change later if I don't like it, I want them to understand something. Later may come with some very different rules than today. Now, that's not a reason to be afraid, but it's a reason to fully understand your options before you ever make a decision. And that's really what good Medicare planning is all about. And our question of the week, and one that a lot of people have been asking me, is Medicare Advantage really free? I know we've all seen the commercials, $0 plans, extra benefits that sound great. And yes, there really are Medicare Advantage plans with $0 monthly premiums. But zero premium does not mean free, and it definitely doesn't mean no cost. First, you're still going to pay your Part B premium, and then you'll be paying as you go with copays, coinsurance, prescription costs, and other out of pocket expenses throughout the year. Medicare Advantage plans also have an annual maximum out of pocket limit for medical expenses, usually several $1,000s, and you have to reach that maximum before you're ever covered in full. But the bigger question is, what kind of freedom are you trading away in exchange for that zero premium? Because these are network-based plans. So that means they're going to tell you which doctors and hospitals you're allowed to use. They may require referrals. And with pre-approvals, they get to decide whether or not they're going to cover your treatments. So the questions shouldn't simply be, what's my monthly premium? The better question to ask is, how do I want my healthcare to work all throughout my retirement? Do I want my costs to be more predictable? Do I want the freedom to make more of my own healthcare decisions? Or am I willing to give that power over to an insurance company in exchange for lower upfront costs? Neither answer automatically makes something right or wrong, but understanding that trade-off is incredibly important. And that brings us right into today's conversation. And it's really the reason why I developed what I call the Freedom First framework. Protect your healthcare freedom, protect your retirement income, and retain control over your healthcare decisions. Whenever I sit down with someone approaching Medicare, we don't start with insurance companies, we don't start with plans, we don't start with premiums. We start right here with the Freedom First framework. How do you want your healthcare to work during retirement? How important is being able to choose your own doctors or keep the ones that you've known and trusted? What would happen if you needed to go to a world-class treatment facility and found out that they wouldn't take your plan? Do you travel? Do you spend part of the year somewhere else? Do you need your coverage to travel with you? How important is it to have predictable healthcare expenses? And how much control do you want to have when your health changes later on? Once we understand all these things, then we can start talking about Medicare strategies. And today, I want to compare the two major approaches, Advantage and Original Medicare with Medigap, through three simple questions. So we've got two strategies and three questions. How do you access healthcare? How do you pay for healthcare? And how much control do you retain? So let's look at how you want to access healthcare. And let's start with Original Medicare and a Medicare Supplement. With Original Medicare, you're able to see any doctor or hospital in the United States that accepts Medicare. There's no Medicare Supplement provider network that you have to stay inside. And you don't need referrals to see specialists. Your Medicare Supplement plan works alongside Original Medicare to cover some or most of the gaps that Medicare leaves behind. If your doctor recommends a test or a treatment, Medicare is generally going to pay for it, and then your supplemental plan is going to cover all or some of the rest, depending on the plan you chose. That's what I call freedom-based care. Now let's compare that with Medicare Advantage. With Advantage, a private insurance company provides your Medicare benefits. That's why they're often called Medicare replacement plans, because your coverage is no longer with Medicare, it's with the private plan. So that means you're going to be working within a provider network. An HMO may have an even more restrictive network and referral requirements. A PPO might give you some additional flexibility, but you still want to understand how its network and out-of-network benefits really work. Most people don't realize that an out-of-network doctor has absolutely no obligation to accept a PPO plan if they're not in the network. And that's typically what we call network-based managed care. And notice, I didn't say one was good and the other bad. They're just very. The question is, which healthcare experience do you really want? Because when you're healthy, that difference may not seem particularly important. But someday later on, when you need a cardiologist, an oncologist, an orthopedic surgeon, or maybe you want to go to a highly specialized medical center like Mayo Clinic, it becomes a lot more important. And that's why Freedom First asks you to think about tomorrow while you still have all of your choices in front of you today. The next question is, how do you want to pay for healthcare? And this is where I think people sometimes make Medicare unnecessarily confusing, because they compare premiums instead of comparing financial strategies. With Original Medicare plus a supplement, you're paying upfront with monthly premiums. And you've got your Part B premium, your Medicare Supplement premium, maybe a separate Part D prescription plan premium, depending on your plan. But in exchange, you'll have much more reasonable, very clearly defined out-of-pocket costs. And those are going to vary a little bit depending on the plan that you choose. Medicare Advantage, it works much differently. Yes, many plans have low or even zero premiums, but that means you're going to share a lot more of the cost as you use care. Maybe that means a $50 or $75 copay every time you go to a specialist. A hospital copay of, say, $500 a day or more for the first 5 to 10 days of each hospital stay. 20% coinsurance for certain services like chemotherapy. A couple $100 for an outpatient procedure. And then there's an annual maximum out-of-pocket limit for covered medical services that you've got to reach before you're covered in full. Typically between $5,000 to $7,000 and well over $10,000 if you see someone out of network, if your plan even allows it and the provider even accepts it. Again, neither structure is automatically right for everyone, but this is where the second part of our Freedom First framework comes in, protecting your retirement income. I don't want someone choosing a plan simply because it saves them a couple $100 this month, because that savings could end up costing them a lot more down the road. Instead, I want them asking, how predictable do I want my healthcare expenses to be over the next 10, 15, 20 years or more? That's a retirement planning question, not just an insurance question. The third theme is, how much control do you want to retain? This is probably the biggest of the three questions for me, because retirement's supposed to be the point in life where you finally earned more control over your time. You decide where you'll travel and where you're going to travel and when, where you'll live, how you'll spend your days, who you spend them with. And so I think it's reasonable to ask, how much control do you want to have over your healthcare too? With original Medicare and a supplement, your coverage is designed around Medicare itself rather than an individual insurance company and their provider network. And that means it's the Medicare rules, not the insurance company rules, that govern your care. You can see any doctor in the United States who accepts Medicare, and you can go to any hospital. So if your doctor retires, you simply find another doctor who accepts Medicare. And if you don't like that doctor, go find another one. Over 98% of the non-pediatricians in the US take Medicare. So the odds are you'll be able to find a doctor that's a good fit for you. If you move, your Medigap policy moves right along with you. And if you travel, your Medigap policy is going to work the same way anywhere in the United States. So if you want a second opinion, you can simply seek another Medicare participating physician at home or really anywhere else in the country without needing to try to find someone inside of a Medicare Advantage network. With Advantage, you absolutely have to understand the rules of the plan. Networks can and will change. If you're with Florida Blue and you've had Memorial doctors, you know this firsthand. Plans can change, benefits can change. Doctors and hospitals can leave the plan at any time, even though you can only switch during one of the enrollment periods. And doctors and hospitals do leave, much more often than most people realize. And then every year, you need to review what your plan is going to look like for the following year. And that same plan might not be available. Now, for some people, that's perfectly acceptable because they fully understand the trade-offs and they're comfortable with it. For me and for the folks that I work with, freedom first means understanding that trade-off clearly before you ever make a choice, as opposed to suddenly discovering it when you need care. And then you find that it's not working out anywhere close to how you had hoped. Let's look at three questions that come up a lot, and that came up a lot last week, in fact. Casey, Medicare Advantage costs less. Why wouldn't everyone choose it? Well, because premium is only one part of the decision. For certain people, a Medicare Advantage plan may very well fit their budget, cover their doctors, and fit their priorities very well. For everyone else, the ability to see Medicare providers throughout the country, avoid network restrictions, and have more predictable medical expenses, along with the ability to keep control over their health decisions all throughout retirement, may be worth paying a higher monthly premium. And that's why I don't believe Medicare decisions should begin with which one's cheaper. It should begin with, how do I really want my healthcare to work all throughout my retirement? What if I'm healthy? Does healthcare freedom really matter yet? That one comes up a lot too. And I would argue that that's exactly when you want to think about it. When you're healthy and you're first starting Medicare, you have all of your options open to you. In fact, in most states, you have that 6-month window from the date that your Part B starts to be able to choose any Medicare plan from any company. Some states give you additional time, but that's a general federal rule. And during that window, they cannot ask you about pre-existing conditions. But once that window closes, medical underwriting now comes into play, and you could possibly be denied for coverage. It happens all the time. Now, I know nobody chooses Medicare hoping that they're going to need a cardiologist or cancer center someday. Hopefully you never do. But insurance isn't for your best days. It's to help protect us on our worst days when things didn't go the way that we had hoped. And that's why we plan while you're still healthy and you have all your options available. Do you recommend Medicare Advantage plans to your family members or close friends? No, I don't. And I don't recommend it to clients either. Every week I talk with people who chose Medicare Advantage because it looked cheaper and then they experienced a health issue and realized that they made a mistake. At that point, freedom first makes a lot of sense. But by then, many of them aren't able to pass underwriting. And when I have to diplomatically tell someone that it's too late for me to be able to help them, that is by far the least favorite part of my job. I recently spoke to a really sweet lady down in Miami. She had a transplant a few years ago, and she was getting all of her post-transplant care at University of Miami. Unfortunately, UM is leaving her plan's network. Now, Cleveland Clinic, which would take her plan, they won't treat her because she didn't have the transplant there. And with her health conditions, even if Medicare grants her a special enrollment period to switch plans, she won't pass medical underwriting. On the flip side, I've seen time and time again how well freedom-based care works for the people I care about. My mother-in-law, Nancy, she's just one of many examples that I can think of. Sadly, she passed away just over 2 years ago this week. Nancy had a Medicare Supplement plan, and when she is diagnosed with 3 different types of cancer as well as complications from COPD, we never had to worry. She chose the doctors that she wanted to care for her, never had to wait to see if the insurance company was going to approve her tests and treatments. We just went and got them done. And so she got to focus on the care that actually extended her life rather than worrying about surprise bills or fighting to try to appeal insurance decisions. So my job is to help make sure you fully understand the trade-offs. I specialize in Medicare supplements because I believe strongly in the freedom and predictability that they can provide. And since I wouldn't ever recommend an Advantage plan to a close friend or a family member, I certainly won't suggest one to a client either. But there are people who are okay with Advantage, and I respect that. I just can't knowingly put somebody in a plan that I wouldn't recommend to my own family. And that means some people might not choose to work with me. And if that's their choice after they fully understand the trade-offs, I'm okay with that. But I'll tell you what, many of them end up coming back a year or two later once they've experienced how those plans work. Sometimes I can help, sometimes I can't. Here's your coffee challenge this week. If you're approaching Medicare, I don't want you to ask which Medicare plan is best. Instead, I want you to ask yourself, what kind of healthcare freedom do I really want during retirement? Think about your doctors. Think about what type of treatment facilities you want to have access to. Travel, your budget, not just your monthly budget, but your savings, your future, and how much control you want to retain. Once you answer that question, choosing the right Medicare strategy gets a whole lot easier. And next week, we're going to go a level deeper, because when you decide that original Medicare plus a Medicare supplement plan fits your strategy, now you've got another decision to make. Which plan? Is it Plan G, Plan N, or high deductible Plan G? So we're going to take a deeper dive. We're going to break down how each works, who each of those plans might be a good fit for, and why the most expensive plan isn't automatically the best one for everyone. And if today's conversation got you thinking about how you want your own healthcare to work during retirement, I'd love to help you. I've put together a free training called the Medicare Enrollment Roadmap that helps you begin charting out your own Medicare strategy. Simply comment freedom in the comments below, and I will make sure that you get it. And if you'd rather sit down together and talk through your specific situation, you're always welcome to schedule a free Medicare planning session. We'll look at your doctors, your medication, your budget, your retirement plans, and more importantly, what really matters to you in retirement and with your healthcare coverage. To schedule that session, just go to medicarequotes.com/Facebook. Call the office, 954-970-4760. Christine will help you schedule a time with me or with someone on my team, or you can just comment planning and I'll reach out to you directly. There's never any pressure and there's no one-size-fits-all answer. Just a conversation that's designed around you to help you understand your choices. Because Medicare isn't simply about choosing an insurance plan. It's really about building a healthcare strategy that protects the retirement that you've worked your whole life to be able to enjoy. Thank you for spending a few minutes and having a cup of coffee with me. And remember, the best Medicare decisions aren't made under pressure. They're made with a plan. I'll see you next week for another episode of Coffee with Casey. Have a great week, everybody.